Welcome to Family Health Today, Arkansas's only weekly in-depth look at the medical and health issues that affect you and your family. Brought to you by Jones Television, in cooperation with our sponsors, Northwest Arkansas Heart and Vascular Center and the Arkansas Democrat Gazette.
Welcome back to Family Health Today. I'm Dr. Jeanette Neshwat. Some doctors believe they have found a medical breakthrough treatment for fibromyalgia patients. It's called BBT, which stands for brain-based therapy. To learn more about this treatment, we are joined by Dr. Jeff Smith, a licensed chiropractor with the Smith Family Clinic in Bentonville. Dr. Smith, thanks for being here.
My pleasure. Thank you for having me.
Absolutely. First off, tell us, what is fibromyalgia?
Fibromyalgia, as you know, is a kind of an autoimmune disease where the body literally attacks its joints, all the joints in your body. Quite a few. It could be your fingers, your hands, your shoulders, your knees, your ankles, your spine, those types of things. And it causes a great deal of joint pain, discomfort, swelling, that type of thing. Very uncomfortable.
Okay, so you said it's an autoimmune disease disorder. What exactly can cause that, for those of viewers who are watching at home who don't know?
Sure. It kind of means your body tends to attack itself for absolutely no reason sometimes. You can wake up one day feeling fine, and 2 hours later you're just aching all over your body. The body self-attacks its joints.
So what are some of the most common signs and symptoms you see, Dr. Smith?
Well, one of the first things we see is undescribed pain, or pain in parts of the body that have no cause. Knee joints, shoulder joints, and hip joints all hurting on the same day. Patients experience that quite frequently. Associated with that is something called fibro fog. If you have fibromyalgia, you know very much what that means. It means you wake up and get through your day feeling like you're in a fog all day long. You have no energy, no desire to do much. You're very lethargic, no drive, no personal instincts to do much. You just feel downright flu-like all the time.
So would it ever follow a flu-like illness, or like a cough, a cold, or any type of illness?
That's a good question. There's a lot of things that can trigger it, and that might be what you're asking. There's three things mainly that trigger fibromyalgia, or other chronic diseases for that matter. Physical causes, for instance, some sort of physical injury, of course lifting injuries, falling down the stairs, that type of thing, or simple things, or getting bonked on the head for that matter. Chemical could be caused by things like nicotine, smoking, alcohol, sugar, artificial sweeteners, those types of things. And then, of course, emotional would be stress. People know that as what's called psychosomatic disorder. In other words, your emotions and your stress can manifest themselves physically in your body.
I see. Do you happen to see fibromyalgia more in females or males, or is it equal?
You know, that's a good question. It does tend to be more common in females, but I don't think we know that that's actually true, because males tend to fight through the symptoms anyway and just trudge ahead.
And perhaps it's just less diagnosed in men? Very
much so, because they don't talk about it as much. They don't want to go to the doctor saying, I feel achy, tired, and depressed.
I understand. Now, tell us, do you see this in a certain age group? Is it mainly older women or men, or do you ever see it in children?
It can be in children. Really? It can be in the elderly. It's very common in the elderly, but the main target group it affects is middle-aged folks.
Okay. Now, tell us, what is BBT and how is it associated with fibromyalgia?
Okay. BBT stands for brain-based therapy. It was developed by a chiropractic neurologist called Dr. Johnson out of Wisconsin. He and a Dr. Carrick developed the treatment for it. Brain-based therapy is a therapy developed around treating the one part of the body that tends to be overlooked when a doctor examines a patient. When you come in saying, I have fibromyalgia and my shoulder hurts and my knee hurts and my back hurt, the doctor looks at your shoulder, your knee, and your back. They don't look at your brain, or more importantly, the cerebellum, or the lower brainstem. That's the part of the body where we find discrepancies or problems from the left hemisphere to the right hemisphere, and we address those issues through our brain-based treatment.
I see. And can BBT used in anyone who has fibromyalgia, from children to the elderly?
Yeah, there's absolutely no contraindications for the treatment. When we get into discussing some of what the treatment is, it'll become more apparent, but there are no contraindications to it.
How exactly does it work in treating your patients?
Okay. Well, for instance, in a fibromyalgia patient, let's say the lower left brainstem is not firing, the lower left cerebellum. That part of the brain sends a signal to the right hemisphere of the brain, which then in turn stimulates stimulates the middle brain. Okay, that middle part of the brain then sends the signals down the rest of the body. If that part is overfiring or underfiring, the signals from right to left get mixed up. So I like to explain it to patients when I talk in seminars like this. Let's say you have an 8-cylinder car engine, and you're running down the road, and the right cylinders are going at 3,000 RPMs, and the 4 on the left are going about 1,200. Your car's not going to get very far down the road before there's a problem. So the same thing is true in fibromyalgia patients. One half of the brain is firing at the right rate, and the other half is underfiring or sometimes overfiring. Of course, when that happens, things like cortisol levels in the brain get triggered, and cortisol levels cause malfunctions in terms of a lot of fibromyalgia patients can't sleep at night. Well, when your cortisol levels are through the roof, you can't sleep, you're wide awake, and you hurt more.
Do you tend to do basic lab work on these patients before you start BBT therapy?
We do 2 types of criteria to determine whether a patient is a good candidate. We do physical examination, neurological examinations, in other words, coordination testing, eye testing, ear testing, inner ear testing, those types of things. We do a neurological test where we use a really neat computerized device that can map out the neurological system in the body and determine from left to right which side is firing, which side isn't, and then literally give me a value. It also measures the patient's energy level in terms of let's say you're a chronically painful patient, your body's going to waste a lot of energy dealing with pain all day long. Well, our machine will measure that and determine how much literal energy you have left over. And not only that, it can tell me how much of that energy you actually can use. And then metabolically speaking, yeah, we do complete blood panels to determine hormones, those kinds of things in terms of how they're functioning with the brain.
I see. Now, you said sometimes the brain is underfiring part of it. Well, what if that part that's underfiring is perhaps due to like a stroke or some organic cause? Will the BBT still work? Will it still have an effect on
yes,
these patients?
In fact, we treat stroke victims. We have what's called stroke rehab treatment. We use aspects of brain-based therapy in stroke rehab. I have a patient right now undergoing that type of treatment. She's a very interesting lady, but she's wheelchair-bound, and we've been utilizing these techniques on her.
Fantastic.
And I guess it was 3 Mondays ago, they called just to let me know that she walked for the first time. So
that's excellent.
Excellent type of treatment, yes.
What other types of medical conditions can BBT be used for, Dr. Smith?
The list is enormous, but more specifically, it's for the very chronic and the very severe of problems. So things like chronic pain, chronic situations like fibromyalgia, failed spinal surgeries where there's been some nerve damage, chronic migraines, you know, not migraines that you've had for a few months, but that you've had for a few years and have tried everything under the sun to treat it with, headaches, restless leg syndrome, all those more chronic, more severe, debilitating typs of problems.
What about like chronic back pains?
Oh, yes, obviously.
Okay.
Yeah.
Do you ever incorporate, for example, acupuncture with other therapies like BBT?
We do. It's an aspect that we use. We use acupuncture for a lot of things, for pain relief, to stimulate nerve function, to stimulate hormones, things of that level. But when we apply it to BBT, we use it on one side of the body or the other, whichever side we determine is underactive, and we use it as a stimulant or an activation type of modality.
Dr. Smith, how many treatments does one need when undergoing BBT therapy?
That's a good question. We have a program that we utilize. Our program involves treatments, 6, 7, 8, 9 types of treatments per visit with a patient. We do it over a course of, on average, about 8 weeks. The patient generally requires that much time. We've had some patients that have had problems, like I mentioned, for 30 years, and we've been able to repair them in 8 weeks. We do that at about 2 to 3 times a week for about 8 weeks, and then after we go through that process, we go about 2 or 3 weeks of some rehabilitation exercises.
So are they going to need it for life, though, maintenance, like
no,
once a month?
Absolutely not. The process of treatment is curative in nature, so when you've handled the situation effectively and established the treatment on it and finished the treatment on it, it tends to be permanent.
Is it expensive? Does insurance cover it?
Insurance does not cover this type of treatment. Much like LASIK eye surgery, it's a very new procedure. We use things like laser treatment, decompression, things of that nature that are very new and very cutting edge, but insurance does not tend to cover those types of things, but it's very affordable as well.
Any last-minute advice for our viewers who are suffering at home and don't know what to do?
Well, one of the best things I tell people when I do my seminar is we usually do a dinner seminar, and I have everybody get a plate of food, and then we sit down and look at it. So when you look at food, and one of the simplest things you can do at home is just change your diet. So avoid things like refined sugar, artificial sweeteners, artificial colors. Try and avoid caffeine, try and avoid nicotine, those types of things, because all those types of things heighten the cortisol levels in the body, and of course that tends to cause or add to chronic pain and chronic weariness and tiredness as well. So that's something very simple you can do on your own at home.
All right. Well, excellent advice, Dr. Smith. Thank you so much for educating us. We appreciate it.
Thank you.
Stay with us. Family Health Today will return in a moment.